For years, Maine has been experiencing a substantial shortage of healthcare workers, specifically nurses.
But for the first time since before the pandemic, one of Maine's hospital systems is making gains when it comes to keeping nurses. News Center Maine's Vivian Lee has the latest.
During the height of the pandemic, Sam Rattel worked as an emergency room nurse at a hospital in upstate New York, an experience that was emotionally and physically exhausting.
We never really got to take breaks or anything.
As the pandemic raged, Rattel joined thousands of other hospital staffers who quit their jobs and hit the road as travel nurses, often tripling their salaries. In November of 2021, she came to Maine with plans to work at different hospitals with severe staffing shortages. Her first assignment was in the emergency room at Northern Light Mercy Hospital. She immediately felt welcomed and supported by her bosses and staff. Her husband also got a great job, and the couple fell in love with the Portland area. After her travel nurse contract was up, Rattel signed on full-time.
Together, we just decided that we like it here and we like where we are and we can grow here.
Samantha Rivera worked as an operating room nurse in trauma centers before and during the pandemic, landing jobs from Missouri to Nevada. She and her family moved to Maine for a traveling nurse position in Mercy's surgery department. Thanks to a positive working relationship between nurses and surgeons, plus an upcoming promotion, she is staying on permanently.
Here I can get certified, I can continue to work on my education and also get experiences that I wasn't able to get as a traveler.
As COVID hospitalizations have dropped, so has the demand and pay for traveling nurses. Northern Light Health still relies on 200 travelers and has about 500 openings for registered nurses system-wide. But sign-on bonuses, competitive wages, training, and certification opportunities are helping change that picture.
I was just looking at our overall retention, and we are getting back to where we were several years ago.
That includes Sam Hanley, a former traveling nurse who spent years at large hospitals in Boston, scrubbing up with Rivera and surgeons at Mercy, where she feels appreciated, helped convince her to put down roots in Maine.
And I think that played a huge role in why I still am here and not a traveler, that I'm permanent here now. And I think it's because I felt so valued.
While making a difference in patients' lives. In Portland, Vivian Lee, News Center, Maine.
Maine Health, the state's largest healthcare system, has about 700 openings for registered nurses system-wide.